Good afternoon. This is a short midday break at the office of Dr. Soloway. Just ran into a interesting situation and wanted to share with my medical students from around the world about some differentiations between lupus and Sjogren's. Just had somebody drive from Maryland with dry eyes, dry mouth, dry skin, vaginal dryness, and nasal dryness. Patient was concerned that she might have Sjogren's. She had heard about it, she had read about it. So while we were discussing the differentiation between the various diseases, and I explained to her that she would need ophthalmology evaluation to look at her cornea and stain the cornea, I explained to her she'll need possibly a minor salivary biopsy, and I explained to her that the rash on her legs was important. I explained to her that the Bell's palsy that she has is also important, and that these things would formulate to a differential diagnosis that included lupus, Sjogren's, sarcoid, IgG4-related disease, lymphoma, and a few other things. Anyway, the point I want to make to you guys that are studying for the boards or you guys who are recently in practice, I wanted to hit 5 quick topics. Neuropsychiatric lupus doesn't occur in Sjogren's. Sjogren's neurologic involvement is typically neuropathy, so that's 1. 2, skin involvement. Sjogren's skin is dry, typically not associated with any particular rash. Lupus patients have biopsies that show immunofluorescent staining at the dermal-epidermal junction. Next, kidney involvement. Kidneys have glomerular lesions with immunofluorescence, while Sjogren's lesions are tubular. Next, let's see, we did neurologic. Lungs. So Sjogren's interstitial lung disease is something that occurs in Sjogren's, and of course it can occur in lupus. However, in lupus, after pleurisy, the number 1 would be lupus pneumonitis, mimicking bacterial pneumonia. And I believe I had a 5th organ. Let's see, we did central nervous system, we did skin, we did, let me check my notes here. I apologize. I thought there was one more that quickly came to my mind. Now it's bothering me. Get the kidney differences. The one last one is hematologic. Platelet count is low in either condition. In lupus from antiplatelet antibodies, and in Sjogren's from hypersplenism. And finally, the risk of lymphoma, B-cell lymphoma, is very high in Sjogren's, period. Sorry, I'm not dictating, I'm talking to you guys. And the skin biopsy. You will get on the skin biopsy in lupus immunofluorescent staining, and the skin biopsy in Sjogren's is going to show, if it does show any abnormalities, will have lymphocytic infiltrates. So it's not that there are no rashes, but it's just not well described or talked about very much, and it's not something I see a lot of. All right, thanks. That's your midday update.